For years, maternal health has been a focus for health officials and state leaders looking for ways to improve access to care across the state.
Today, those efforts took center stage at a statewide roundtable, bringing those leaders together with one goal: better care for mothers and families. THV11's Maya Ellison spent the day at the discussion, finding out what it could mean for mothers across the natural state.
The Arkansas Maternal Health Roundtable is much more than a conversation. As many tell me, it's a collaboration on ways to fix a broader issue.
And we are now down to 30 hospitals that have a labor and delivery department.
That's a harsh reality for a state that health leaders say continues to struggle with maternal health, and one that can make access to care even more difficult, especially in rural communities. Arkansas Hospital Association Executive Vice President Jody Ann Tritt says it's why the people making policy need to hear from the people providing care.
I think having those conversations with the right people in the room, with physicians, with advocates, with federally qualified health centers, of course with hospitals, on the front lines of how we take care of moms when they get to deliver their babies.
Lawmakers, healthcare leaders, and mothers heard from state officials, including Governor Sarah Huckabee Sanders and DHS Secretary Janet Mann, about issues they're seeing.
Pregnant women are seeking care in multiple locations during their pregnancy. It's not always the same location or same entity.
Those, like Anna Strong, say that's not the only concern.
It is alarming to look at our infant mortality rates and the percent of moms in our state who are giving birth who may not have optimal health outcomes.
Strong tells me finding a solution lies in advocacy work along with providing support to moms all over the state. But that leaves the question:
How do we bridge the gap? What does that look like here in Arkansas?
I think the gap is really that postpartum care that we really need to wrap around in new and innovative ways. We have got to have more touch points, and we've got to have access to an insurance such that they can get the care that they need.
In Little Rock, Maya Ellison, THV11 News.
All right, Maya, thank you. Well, Secretary Mann says the conversation continued today at the state capitol, where lawmakers reviewed Rule 311. It's a proposal to implement new maternal health requirements, including Medicaid-related coverage for services such as lactation support and doula services.